Hello, I'm Dr. Frances Pitsillis. What is DHEA? Well, it's short for dehydroepiandrosterone. Well, that's a mouthful, isn't it? Well, dehydroepiandrosterone is a couple of steps away from the mother hormone that comes from cholesterol called pregnenolone. So pregnenolone can go across to DHEA and then across to progesterone. And DHEA then goes off to the male hormones and estrogen, but it can also be turned into progesterone. So I call it the quality of life hormone because it is 10 to 20 times more abundant in the body than any other hormone, including vitamin D, progesterone, estrogen, testosterone. And DHEA has associated with it a lot of important factors, which include less depression and better psychological profiles, more enjoyment of life and of leisure activities, better sexual desire, arousal and function, less vulnerability to stress when your cortisol levels go up in response to stress, reduced anxiety and fear, reduced post-traumatic stress disorder, better cognition, improved executive function, that's rational thinking that occurs at the front of your brain, better attention, concentration and working memory. Processes like learning and memory are much better with a better level of DHEA. And it seems to have a stress buffering effect by buffering the cortisol that goes up when you're stressed. And also there's lower perceived stress at work. So how does this all happen? Well, as people get older, their DHEA declines, but also what drains it more is stress and disease. We know that DHEA specifically has many effects on helping to prevent heart disease and atherosclerosis because it's anti-inflammatory, reduces blood vessel tension, reduces atherosclerosis and ischemic heart disease, improves coronary angiograms, and it's been measured that damaging messengers like NF-kappa B are reduced. We also know that DHEA stimulates bone formation, and that's because it turns into progesterone, estrogen and testosterone, which further helps bone. When it comes to women, it helps their sexual satisfaction, fertility, because it improves the egg, and it also improves vaginal tissue function. It's particularly good in postmenopausal women who don't want to have estrogen. In fact, I will often, in older people, just use some DHEA and melatonin to help quality of life. Indeed, it's better in older women to use DHEA because there is a phenomenon called intracrinology, as opposed to endocrinology, whereby the tissues themselves know what they want and they will convert DHEA exactly into what they want, not just the DHEA converting into something else. The benefit of this intracrinology is that there's far less risk of getting excessive estrogen or excessive anything that might be damaging to the tissues. And we also know that there are no DHEA receptors in the female uterus. So what else does DHEA do? Well, we know that people get older, they lose their DHEA and they become more immune incompetent and more inflamed. Well, DHEA prevents that. So it prevents the diseases of aging and it prevents the increase of inflammatory messengers from the immune cells like IL-6 and TNF-alpha, and it prevents something called lipid peroxidation, which means it stops the fats in your body from going rancid. Now that's a good thing, isn't it? DHEA also helps to improve, prevent and reduce autoimmune diseases like rheumatoid arthritis. It also helps in allergy. And DHEA has a lot of work that it does in the brain. It protects nerves and encourages nerve growth and survival. It helps in the production of neurotransmitters like dopamine, adrenaline, and noradrenaline. It's an antioxidant and an anti-inflammatory in the brain. It has an effect on endorphin release. That's the happy type of natural morphine that you have. It works on several neurotransmitters, including GABA, which calms you, dopamine, which is the pleasure chemical, and glutamine, which helps with energy and excitation. It increases brain-derived neurotrophic factor, which is food for the brain, and it helps to grow the nerves. And it also works on the emotional circuitry in parts of the brain where fear and anxiety cause a lot of influence and then propagate the fear and anxiety. And these areas include the hippocampus and also the frontal part of the brain, which then gives you better emotional control. DHEA reduces metabolic syndrome, diabetes, and helps you lose weight. It lowers blood sugar. It lowers insulin levels. DHEA helps chronic kidney disease and reduces inflammation and oxidation and reduces mortality. Now, how do I prescribe DHEA? Well, it's not the first thing I'll prescribe. I need to be careful that that person may not be at risk of breast cancer or prostate cancer because DHEA can turn into estrogen. We have to be very careful. Having said that, there are quite a few studies that have shown that it's safe and effective. I do a blood test and I look at that blood test as a guide and also look at that patient's symptoms. And then if we've tried other things and then we're interested in optimizing the DHEA because the person hasn't improved well enough, then I will use that. And then I can follow it according to their symptoms and how the blood test is going as a guide. So as you can see, something that you may not have heard of has been around a long time, has been used for so many things and has so many benefits and is relatively safe in the right hands in a person who has knowledge and experience in its use.